I think that sometimes I tell people about the community children's clinic and they've never heard of it,
Mhm.
which it's been here for a long time. So I think one of the things that I would like to see is just more awareness of what the clinic is and what we do. And I mean, we do have a website and we have social media, and so the information is there, but I think just being more involved, like having a fundraiser and doing those things, um, gets the word out to people who maybe could be potential donors or board members or patients.
Hi, ladies. Welcome to the Good Work West Texas podcast. We are so excited for you guys to be here today and just sharing about Community Children's Clinic. We have Dr. Mraz, and she is the medical doctor there at the clinic, and then Renee Miner, who's the executive director. And so we're just looking forward to a great conversation about the clinic and about your lives and how you got, woven in with the clinic and what you do. And so we just look forward to joining. Thank you for joining Leslie and I in
Well,
this morning.
thank you
So
for having us. We're
yeah,
excited.
Yeah, we
yeah,
are.
I am excited. Really excited too. So, really, what we want to start out with just a little bit of your background of how, if can you give us some information about the clinic? We always try to inform our viewers a little bit about what the organization that we're talking about. Maybe if you want to start with the history, and then if you want to, we can move on to like how you guys got involved and what that looks like.
So the clinic started in 1984, and like a lot of the nonprofits here in town, or I guess all of them, grassroots effort by some people in town who realized that there were kids that didn't have access to medical care. So, in those days, doctors didn't want to see patients who were self-pay.
Okay.
And so the clinic was sort of born from that. There were quite a few people going to the St. Presbyterian Mission, and so out of that group, they started the clinic. So we've been in business for a bit, and so we serve kids who don't have medical insurance and don't have Medicaid, low income families who are living paycheck to paycheck, and when their children get sick, then it sometimes can be a question of, do I pay this bill or that bill, or do we go to the doctor? So, a lot of people that come to the clinic say if we weren't there, they would have gone to the emergency room, they would have waited to payday, they would have just tried to treat over the counter. And with small children in particular, when they get sick, they can get sick in a hurry and go from just needing an antibiotic to needing to be hospitalized. And so the clinic is fills in that gap for those families so they can come to the clinic and see the doctor when they need them. And then they can go home with a prescription as well because we have an in house pharmacy. So it's kind of a one stop shop.
Mhm.
And so that's how we started.
That's fantastic. Well, so many people in the community, I talk about, community children's clinic when we're at different places or different events. And they're like, I never knew that we had that. And I'm like, yes. So we're really excited just to see the vision of people that very long time ago committed and saw the need in Midland and then just committed to, hey, let's make this happen. And so I love to talk about those legacy stories and then to invite new people in to the conversation of what you guys do and you know the different facets that you serve. So Dr. Mraz, tell us a little bit about your involvement and your what you do at the clinic
Mhm.
as well.
So at the clinic, I'm the medical director. So we have an awesome team. I every day I go to work and I think, oh my gosh, everybody has their job and their role, and the clinic is run so smoothly because we all do our part. The nurse that helps me every day has been there for probably 14 years,
18 years.
18 years. Sherry, she's amazing. So she rooms the patient for me, kind of gets a little bit of the history, and then I go and evaluate the patient. We see patients from 6 months to 18 years. Sometimes I'll go in a room and it'll be one child. This morning, I had three kiddos, all sick in the same room, that all needed to be seen and all needed our help. We can do flu tests, COVID tests, strep tests. We do urinalysis, tests for RSV. So we have a lot of, in-house tests that we can do. If some child needs an X-ray, we can order that for them. I've seen a lot of kiddos that have broken finger or broken arm, and we've ordered the X-ray for them, and the clinic actually covers the cost for the family,
Wow.
which is amazing. I mean, an out-of-pocket X-ray for some people can cost $200 or $300, and so the fact that we cover that for the family is a big relief to them. And if they're sick with something that they need antibiotics for, we we have the antibiotics in the clinic, so I can treat right then and there. They don't have to go wait at the pharmacy for their medication, and they get that medication all for the flat fee of $20. So I treat with whatever the child needs. We also carry over the counter medications. And so if they need Tylenol or Motrin and they can't go to the CVS and buy it, they don't have the money to buy it, we give that to them as well. So I think the clinic itself is such a good resource for families that don't have resources. And it's a blessing to a lot of people, I think. And like I said, our team is great and we all have our role and we all do it well, I think. So,
I think it's not only the convenience factor, which I love, just that, I know when you have sick kids or a sick family member, and it's one thing getting to the doctor, and then it's another thing going to the
yes.
pharmacy and then having to go somewhere else for other care. And I think that that's just a huge convenience factor for people that have multiple children or different things, and you can get that immediate
Mhm.
just care right there. So it's really neat that the clinic is set up that way to really just be a kind of a one-stop shop. I mean, I'm
Mhm.
sure that you refer if they need to be, but it's great that you have those resources there, and then to provide for those families that don't have that. I know we've talked about before, um, we never want to assume things about a client. It could be a family that recently lost insurance or
Mhm.
other things. So, can you tell us a little bit about the more specific about the clients that you do serve? And are there any qualifications that they need to have to come? And how do you do that?
So the clinic stands in the gap for those families who are in the income bracket where they make too much money to qualify for Medicaid and not quite enough to be able to buy insurance, or they may have catastrophic insurance. So they're still paying everything out of pocket unless there's a hospitalization or something like that. And the families that we serve are they're hardworking families, and so certainly we have some people who come who qualify for Medicaid who aren't on it for one reason or another, but a lot of our families are just working paycheck to paycheck. And I had one mom tell me one time, I don't live paycheck to paycheck, I live paycheck to the next day. And I thought, okay, oh, I've been there and I remember what that was like. And in the old days, when I had my kids were growing up, the doctors, a lot of them would allow you to make payments. I had a doctor that let me do that, but today they want a lot of that up front. And so I hear anywhere from 85 to $100 just to walk in the door with one kiddo. And if you've got, as you said, three in
Three.
one room,
Mhm.
and then 85 times three, it's a lot of money for some folks. And so, can you think of something that and you have to live in Midland County. That's one of our
Mhm.
caveats.
Okay.
So, I've seen and talked to families and we've seen kiddos that, maybe the dad lost their job and so they lost insurance and then the dad was looking for another job and the kiddo got sick.
Mhm.
Well, the choice is do they go to the ER and have a large bill or they can come see us. And I remember in particular there was a kiddo that I saw that had autism and they they did have insurance, but between jobs lost the insurance and he really needed to be seen and he was sick. And so I just remember the mom saying, she was so thankful that we were there, that she could come
Mhm.
and be, seen for a
Mhm.
price that's realistic that they could afford and get the medications that the child needed. Um, and, they were working on getting insurance and, maybe next time they would go to their normal PCP and but in that short time frame, they needed us. And I think that's like a lot of what we do is the people that, maybe are in between jobs or, some insurances are so expensive. They can afford to put the parents on insurance, but not all the children. And, the kiddos need care too. They may not have chronic conditions, but I mean, we all know kids get sick. I mean, we just started back to school and now there's the rush. But we see a lot of those kinds of cases too, just, in between insurances and so.
So, last year we saw a little over 1,000 unduplicated patients and close to 3,000 visits. So some of those kiddos came one time, and some
Mm.
of them they may have come two or three times. So it does vary. And so we have some families that use the clinic on a regular basis, and then others, as she pointed out, that come and go. So.
That's my question is, so we're seeing pediatrics, I'm assuming, only
Mhm.
18 and
7
under.
months to 18 years of age, and you still have to be in high school.
Okay. And so will you see kids for wellness visits or only sick visits? Like you would stand in the gap as the pediatrician, or it's for sick
It's
emergency
mostly for
care?
sick.
Okay.
We do a lot of sports physicals. We actually just finished a week of free sports physicals for the community, where that's kind of like our give back to the community for all that they do for us. And so we saw, you know, 20 sports physicals every day during that week, plus sick visits. Um, and we'll do daycare physicals. So if a child needs an evaluation before they start daycare, which every child does, we do that. We're not designed to be the true like pediatrician for well child checks, and we don't offer vaccines.
Okay.
So, we do have some kids that come in before school and they just want a physical, but really it's more sports physicals, and we'll direct them to where they need to go for vaccines.
So tell us a little bit about when we're talking about just the benefits of just having that low cost for families and how important that is to them. So tell us when you think of our audience listening and they're like, okay, well, somehow that you have to make up the difference for staff and the money that's involved. So what does it look like just for a donor to know where his or her money is going to help support the clinic and what are those things that help make up the difference?
So we are funded in a large part by local foundations, and then we have private individuals that donate, and some businesses that donate as well. We started an event last year. It's called Dink Dine, and it's a pickleball tournament, and so that helps fill in the gap a little bit there. So the this is a charity that stays in your backyard. So if you donate to the clinic, your money is going to stay in this community, and we have very low overhead. Basically, our biggest cost at the clinic is just salaries, and we have a small staff as well, and we have people who can sort of cover for one another. The other thing is that we have a couple of partnerships here in town. Number one, Midland Memorial partners with us, and they help us with any kind of radiology test that we might need, X-ray, MR, ultrasound. They give us a reduced price so that we're able to do that. And then our other big partnership is with Texas Tech. And so they have a family practice residency program. They rotate through the clinic a month at a time, and they provide that depth of staff because if Dr. Mraz has to be out or wants to take a vacation, which occasionally she does, that they can step in and still see patients for us even when she's not there. So we couldn't do what we do without those partners. And a fun side story is that Dr. Mraz rotated through the clinic when she was a resident.
Mhm.
And so that's been, how many years ago was that?
Like 8 or 10.
So
Great.
it's funny because as the residents rotate through, we'll be, we knew at that time Dr. Rhodey was there and we knew she was going to retire. And then Dr. Case came. But um, Dr. Mraz was one of the doctors that after she left, we were like, oh man, I hope one of these days
She
she
would be
wants to
great.
come. And then, so she just celebrated her 1 year anniversary.
I did.
And so we're really happy to have her be part of that. So we couldn't do what we do without those partnerships. And of course, our donors, that they're the ones that we get to be the hands and the feet. And so I hate it because a lot of times the donors don't get to see the backstory. But the work that they're doing it's amazing. And just think about that one time you're down on your luck, you woke up in the middle of the night, your kids got a fever of 104 and you don't know what you're going to do, then just being able to go to the clinic and get in and see somebody right away. And we don't ever turn anybody away for the inability to pay. So the families will make that up the next time they come, or payday, they may drop that. It's $20 for them. And so, sometimes you don't even, I've had people tell me I had to borrow money to come today. So, that's you're supporting those families that are working really hard in our community and living here and raising families, and they just sometimes need an extra little hand.
Mhm.
That's great. So tell us a little bit, Renee. You've been involved with the clinic. I'm not sure for how many years, but several. But tell us a little bit about just how you got involved and maybe the people who, went before you or mentors in your life that really maybe guided the direction of your life and what they mean to you in that.
So I celebrated my 11th anniversary this year, and I was so blessed to have the opportunity to go to the clinic. I had worked at Midland Children's Rehab for 20 years and loved that place, but I just felt like God was pulling me in a different direction. And that very first day you walk through the door and you wonder, is this ever going to be like, the place that I left, which had a great staff and it was very much home for me. And those ladies took me in, and they just, it was like I had always been there. And Dr. Mraz hit on that a little bit. I think um, the thing that we have going for us the most is the staff.
Mhm.
Everybody there is passionate about the mission and they just want to help kiddos. And so I moved over to the clinic, and I have always been so grateful for the people that came before me. They created an amazing organization, and they made sure that the money got spent the way that they said that they were going to spend it. And it's a welcoming environment. If you go to the clinic, it's nice and it's bright and it's cheery, and it's a place that you can feel comfortable bringing your children to. And so I recognize that the work that we're doing today, we're just carrying forward what those ladies that came before us created. And so I don't really even know how I got into the nonprofit business other than I went to school and became a physical therapist assistant, went to work at MCRC. And I remember telling my dad I wanted to be a social worker, and he just laughed and he goes, no, you don't. They don't make any money. And I thought, okay, well, I may not be a social worker, but I guess then I knew I wanted to get into something where you're serving other people. So I have the best job in the world, and I get to work with an amazing group of ladies. And I don't know, I can't imagine doing anything else.
Mhm.
So with that serving, we're in the business of trying to help people get plugged in to serve. So with being in a specialty of medicine and licensing and different legalities that have to be followed and in place with the nature of the work that you do, but is there something that people can do, a way that people could give back? People who are passionate about medicine, like myself, is there ways that people can volunteer or things that people could do inside of the clinic or outside of clinic hours? What does that look like?
So we utilize volunteers in a couple of different ways. And so at the front desk, we have a receptionist So we have kind of office skills that we need in that area. You don't necessarily have to have a medical background for that. We're always looking for translators because we have a large Spanish speaking population. And and then also licensed personnel, as you pointed out, is important. We could use some support maybe in nursing or in the lab, but they would have to have some special certifications for that. And then, of course, we have our board. Oh my gosh, our board of directors, they are they're the thing that keeps us going. They're all in the community working and playing and raising families. They're passionate about the clinic. Some of the people on our board do have medical backgrounds and some do not. So it's just a matter of, I think anybody who enjoys working with kids would be a good fit for our board and our committees. We have several community members on the Dink and Dine committee this year. So there are several ways that you can plug in. So they just need to, they can find us on Every Neighbor. We have some things listed there. Other things I can think of that you mentioned is sometimes we take donations for exciting things like toilet paper and paper
Yeah,
towels.
paper towels.
Yes.
Go through those. Kleenexes.
So if you don't want to come and, or don't have the time to come, yeah, donating items like that's a huge help. Now we don't have to put that into the budget because something like that's already taken care of. So can you think of anything else?
I mean, I think, the board and the committee members, this Dink and Dine fundraiser's new. And so that's a good way for people to support the clinic. I mean, if they like to play pickleball, they can come and have fun. And it's a good way to give back to the community by giving to the clinic. So,
Yeah. It was so fun.
I was going to say, yeah, we were there last year.
We were there
We
last
didn't
year.
play,
No.
but we were there. We ate,
We were
we cheered.
intimidated. Honestly, we were like, okay, are we good enough at pickleball to play?
you
So
are
you
good.
have lots of levels.
The
right?
answer was no. I had literally played one time, maybe two, and I think Cindy had played one or
Maybe
two times. I
once.
was like,
Yeah.
maybe next year. So
Well, are you going to play this year? Yes.
I've tried to find two partners to play, and they're both out of town. So, and I couldn't remember if Cindy was out of town. I couldn't remember if you were out of town. So, but I would love to play. Play is
Uh,
questionable, but
Just
I own a paddle
speaking of
and some balls.
Yeah. I think the thing is just have fun. It's a place to have fun. And that's what I remember from last year. Just, all levels of people cheering each other on and having fun and
some
doing
people
that.
who brought their own cheering.
And their
Cheering sections.
signs,
Yes.
that's what I was thinking about. The
exactly.
people who had the signs
on the
over the
other side of
fence
the
and they were
fence,
like
yeah.
cheering for their people.
Fan
Yeah.
club.
I'll play if I can have a fan club.
I'll be your fan club.
Okay.
I'll
play.
get your
You'll
poster
make
ready
me a
right
poster.
away. Yes, ma'am. Don't you worry.
That's right.
I'll
That's
make you
awesome.
proud.
Well, Dr. Mraz, tell us a little bit about your background. Obviously, you came through the clinic as a resident, but what what made you want to serve at the community children's clinic? Like, what was it that you just said, "Hey, this is a place where I can still practice,
Mhm.
give back to the community"? Tell us a little bit about your background.
So I didn't grow up in Midland. And so I came here and my husband's in oil and gas, so that's a lot of people's story. But I came here and finished med school and residency. And I rotated through the clinic, and I just remember thinking, wow, like this is what medicine is all about. You get into medicine thinking you want to take care of people, you want to serve people, but sometimes you get burned out with insurance companies and all of the like paperwork and things you have to do. And I just remember working with Dr. Rhodey and thinking, this is so much fun getting to make a difference in people's lives and like getting to just prescribe the medicine and having it right there and not worrying about the cost. I mean, we do worry about the cost. We try to be very good stewards of the donations and the funds that we get from our donors, but being able to give the things we need when people need them. And she just Dr. Rhodey seemed so happy, and I was thinking, "God, I would love to come back and do this in the future, be a servant for people." And so I told them, I said, "I really like this place. I could totally see myself coming back here, but I had to go do something else first." So I worked for the hospital and I did outpatient family medicine and I loved it. I had amazing patients. I have 4 kids, so I'm really busy at home too. But actually, the clinic reached out to me when Dr. Case was wanting to retire, and they said, we have a doctor who's retiring, and we have an opening if you're interested." And I thought, this is it. Like, this is what God wants me to do. And so that's how I changed my whole career. And well, not career, but I told the hospital that I really felt passionate about moving over to the community children's clinic, and I've loved it. I really have. So I just celebrated a year and it's been great. And I have nothing but good things to say about the clinic and what we do, and who we serve, and the families are grateful. They really are. So it makes it worth it for sure.
And it's such a critical area because you think about, housing, food, those kinds of obviously the necessities of life. But when you think about your health and your children's health, it's a huge component
Mhm.
of concern and care for parents to know that they have a place to go and to get that care when they need it. And so I'm just thankful that you're there and just for your stories of, just being willing to be in the harder places. I'm sure that there's a lot of other things that you guys are totally capable of doing. And that's the thing is I think it is a commitment to really serving and caring for other people and having that awareness and willingness to step into a place that is not traditional necessarily, but that you have an opportunity to really serve alongside and get to know our community hands on. So, um, where do you see the clinic going? I mean, what are your dreams? What are your goals for the next few years, and how can the community help in support of those things?
Um, you know, I think that sometimes I tell people about the community children's clinic and they've never heard of it,
Mhm.
which it's been here for a long time.
Mhm.
So I think one of the things that I would like to see is just more awareness of what the clinic is and what we do. And I mean, we do have a website and we have social media, and so the information is there, but I think just being more involved, like having a fundraiser and doing those things, um, gets the word out to people who, maybe could be potential donors or board members or patients. And the schools do a good job too. I think we're getting a lot of patients from the schools. They're telling the parents that, if they don't have insurance, there's no need to go to the ER. You can go to the community children's clinic. So we're thankful for that. And I mean, we are busy. Now that school has started back up, we are definitely busy. We could be more busy, but I think that's one of the things that I would like to see is just more awareness of what we do and who we are. I don't know if you have anything to add to that, but
No, and I think that's every nonprofit's issue because nobody has a big marketing budget for something like that. But also, I guess I don't know if there's something else out there that we could be doing and would be logical partners for, but we do love collaboration. And so if somebody else out there is watching this and they see something that we could maybe collaborate or partner with another organization on, that's something that we would love to do. We do have some capacity. And so I don't know. But I would love to, if we could grow it, that would be great, as long as there's a need. So,
Right, right. That's good. Well, and I think there absolutely, I love just I think it's one thing with collaboration, it's so important. And I think just to see, even the collaboration with the hospital and with Texas Tech, those are huge partners that the hospital can't service every single need, but yet we have support and organizations that help fill in some of those gaps at the basic level. And I think that's really important for our community to know. And obviously, we want you guys to continue and just to have that support because we realize you're filling a huge gap in the community there. So collaboration is important, and I do hope that there are other partners that, if they have ideas on things, just your willingness to, you know, we Leslie and I talk about so much about just having an abundance mindset of, a lot of times nonprofits can get discouraged about there's not enough volunteers, that there's not enough money, or there's not enough, something. And just trying to focus on no, there's a lot of good work happening here. And there's a lot of people who I believe everyone wants to make a difference at the basic level of inside their hearts. They want to make a difference. And so how can we better communicate with them? How can we share that and inspire them to be a part of um what their passion is and how they can be involved in the community in some way? And so I really appreciate what you guys are doing, and I'm sure Leslie has another question for
I
you guys.
actually, I've been
I know
racking
she
my
does.
brain. Renee and I have been friends for a long time. And Renee, there was a time where you and I were talking, and you had shared a story, and I cannot remember exactly what it was, but something about a young lady who came through the clinic as a kid. And then I can't remember if she ended up bringing her kids. There's some like great story. I would love for our listeners to know. It covers a long span of the time that the clinic has been open. Do you know what story I'm talking about?
I don't in particular, but let's see if I can get close. So, one thing I've been surprised about is being out in the community and meeting people in different organizations, and they ask me where I work, and I tell them, and they say, "Oh, when I was a kiddo, we used to come there." So, I know at my orthodontist, I ran into a young lady, and she, was telling me about her grandmother ended up raising them, and so that's what grandma could afford because this has been a while. And so, but it's cool to see that, some people come through, they just need it for a little bit. And if you give those folks a boost, then, I think they can go on to do amazing things in the community. Some that I've met who serve on like United Way and they're busy in the community. And we certainly do have some families that are more generational who, grandma may have come as a child and mom and now the kiddos are coming. And so we recently opened up our financial guideline just a little bit because we did some research and realized that, moving out of poverty can take multiple
For sure.
generations. And so that's not necessarily a negative thing for the clinic to say. I think it's important to know that we're able to support people until they can get there. And then I've been out in the community and met a lot of people who just were there for a moment and then they didn't need us anymore. And then I've had some professionals that, as you were saying, they were between jobs and then they never thought they need to bring their kids to the clinic and they did for that one time. So no, I'm sorry, I don't remember.
No,
Darn.
I
I should have written that
maybe she
down.
became a nurse. There was some legacy story, and I can't remember what it
Oh,
was, but it
well,
was like
we did
made
have
my heart happy.
a young lady who came as a kiddo, and then she went on to nursing school and became a nurse practitioner, and she used to work for Dr. Rhodey. So, and she has a practice here in town now.
Okay, maybe
Mhm.
that was her
Yes.
story. I just remember thinking, like, I love the stories where you can see a full circle,
Yes.
where this was something that helped someone.
Uh-huh.
Her as a little girl wouldn't even probably realize she's getting the help that she needs,
Mhm.
but that was able to help her, and that didn't define her story.
Yes.
She has gone on to do great things, and I just love that. I love that y'all are there. I have a deep heart as a nurse myself
Yes.
for what you do, and yeah, I think that more people need to know that you're out there for all of the reasons to help financially. I think it helps our city as a whole if we are taking the load off of the ER.
Mm-hmm.
It helps the financial burden of the taxpayers when all of those unsettled ER bills are not just sitting there because people cannot afford to pay them. And as a county hospital, that looks different.
Right.
And so I think that in any way that we can help get the word out, I would love to help do that on multiple levels because I just applaud what you do, and I think that it helps our city as a whole.
Well, and I think our partnership's been important too. I know when you guys first came to talk to me about it, I was like, no, I don't think, we can afford that. I don't think. But you guys pressed on, and I'm so grateful that you did because you have been a great strategic partner in helping us get that information out. Leslie is amazing at building things that I just, not only do I not have the time for it, not that it's not important to the clinic, but there's just only so many hours in the day, but I also don't have the technological skills that you need. So, you guys have been wonderful about promoting us and then on the back end of all of that, helping get things up and going. Because honestly, if Leslie wasn't doing that for us,
Mhm.
I, we would have a blank page at
Yeah.
every neighbor. Honestly.
Well, and that's what we want. We realize that every nonprofit's different. Their needs are different. Their staffing capability is different, and especially for you guys being a smaller nonprofit, it makes a lot of sense for us to be able to do that for you. And so we've loved the partnership with you and just the ability to share with the community really the good work that you're doing. And that's when we first started this podcast. I told Leslie, I said, this this name just keeps resonating. Like I just want to tell people the good things. So many times we hear all the negative, and I just want to be a positive voice for what the good that is happening. And I want people to know the people that are involved behind the scenes because that's what makes our community different. That's what makes our region different, honestly. And I feel that the more people that can know about that and be inspired to get connected in whatever way, whether they can play pickleball, donate toilet paper, write a big check, whatever that looks like, we want people to know what's out there and how they can make a difference and make it really clear of how they can get involved. And so we appreciate that. Um, Leslie's got a little surprise for you, and um, it may it it may take you a minute to like think through
Figure
it.
it
Trying
out.
to make so much noise with my noisy bag
Yeah.
that's in the microphone.
I
It's
was
like,
thinking about this. This is kind of a funny backstory, but they came to the office. I guess so it's been more than 2 years ago, and we were just talking about how we can promote the clinic and everything. And we were talking about an event, and so the board had already been talking about a pickleball tournament. And then they were sitting across the desk from me and they said, you know what we think you need to do is a pickleball tournament. And I went, thank you, God, for the confirmation.
yes, this is it.
Yeah.
He works in mysterious ways.
It
So,
does.
okay, so in the bag, there's Leslie and I love quotes. So we love just quotes about service or giving back, um, things that will hopefully inspire people. And so, what we're going to ask you to do is each of you to take a quote out of the bag
Okay.
and then just read it and respond with your thoughts. It's kind of fun.
Oh, it's a
It's
game.
yeah,
It's a game.
It's a game.
I love games. All games make my heart so happy.
Oh,
I thought it was going to be a present.
It's not real. We don't have a present.
But
Okay.
it's not a snake.
that's good. Yeah, I'll grab
Yeah.
this one. Give that.
Okay, my quote is doubt does not deserve you.
Mm.
Okay. How do I feel about that quote? I think everything happens for a reason, and God always has his hand in everything that you do. And so you shouldn't doubt where you are in life or what you're doing because that's what you're supposed to be doing.
Is that, yeah.
Yeah, it's
Like
great.
it.
There's no right or
Yeah.
wrong to this. It's just, it's awesome. Yeah.
And mine's blank.
No.
It really is.
You got
That that is the $1 million.
Create your own. Yeah.
That's the $1 million ticket.
Renee?
I don't have one.
Pick
That's
out another
almost
one.
worse.
I got another one.
Man, now I'm
What's the
really
trick?
sweating. I was just going to play a joke on you and say it was blank, but the world is your oyster. Oh, gosh. You know, okay, this has probably nothing to do with this, but um, you know how when you go, well, maybe y'all don't, but when I go on vacation, I'm almost like a different person, right? I'm happy and excited. And when we had small children, I feel like I was fun on vacation and I'm not. And so the world is your oyster makes me think about somebody who enjoys life like that. And this last time we went on vacation, I thought, why can't I be vacation, Renee, all the time? So I don't know. Maybe I should have stuck with the blank one.
No, I think that's great. I think that's
I
great.
do. I think it's great. And I think it's a great
And so you guys are
reminder.
going to do it too, right?
No, no, this is just for you. This is just for you. I think that's great though. I mean, we love to just kind of have something spontaneous that people are like, oh, and I think it tells a little bit about you personally. I mean, I think all of us, we're always, I loved your words about, not doubting.
Yeah.
Because absolutely, um, we he has a plan, and I think that there's a piece of that where a lot of times we can question what we're doing, and a lot of times when you're doing the hard things, you even question more of, am I crazy in what I'm doing?
Mhm.
And but just to have the confidence to know to take that next step is important. And yeah, and could we all be vacation Cindy, vacation
I am a
Leslie?
good time
Yeah.
on vacation.
Excited.
I just want the world to know Vacation Leslie is a great time. A great time.
I believe it.
She brings a lot of fun to the everyday
have
though. Yeah.
laundry piled up to the ceiling.
Yes.
If it was vacation casing.
That's right. That's right.
You
That
know,
wouldn't be
take it on
good.
a
That wouldn't be
vacation.
good with 4 kids.
Well, thank you so much for just sharing about the clinic and sharing your stories and just sharing your hearts with us. And I hope that if anybody is interested in helping with Community Children's Clinic in any way, they can find you at the website. They can find you at everyneighbor.com. And just, we want people to get engaged and be inspired. And so thank you for taking the time just to visit with Leslie and I and have fun. And even with the blank, we should have had you create your own. So
Yes.
anyway, but
I don't think that
yeah.
fast. You know, I'll go home and go, oh, I should have said.
you should, no, you were great. So thanks for the time.
And thank
Thank
you
you.
guys. We appreciate you.
Thank you.